Okay, so the respiratory tract also includes the larynx and the trachea. And so this is where we're getting into the lower respiratory tract. The larynx is an opening into the trachea, and so it also includes the epiglottis and the vocal folds. So this includes epiglottis, which helps to route the food away from your trachea, and the vocal folds, which are actually what are sometimes referred to as the true vocal cords, which consist of ligaments. And so this is what generates sound as the air moves across their surface. They vibrate, and that vibration creates sound waves that we can then use to speak, right? To make sounds, to communicate. Okay, so if we look at the larynx, you'll remember that it can be palpated. We can kind of feel it. When we look at an image of it, the larynx, let me get to that. Okay, here you can see where it is located. Here you can see it is enlarged. The enlargement is actually due to an enlarged, in males, an enlarged thyroid cartilage. So if this is the structure of my hyoid, or excuse me, the structure of my larynx, we have the thyroid cartilage right here. And then we have what is called the cricoid cartilage, which is right here. And then this is going to eventually connect down to my trachea. So we can feel the laryngeal prominence, which is just part of that thyroid cartilage. Why is it called the thyroid cartilage? Right here. That's because it kind of sits where the thyroid gland sits. So the thyroid gland is in your neck region underneath this structure. So you'll also notice that this is connected to the hyoid bone. So this bone is super interesting from an evolutionary perspective because it's actually one of our pharyngeal arches. In fish, these pharyngeal arches turn into their gills. In us, they mainly go away, but we have this one bone that actually looks very much like a gill arch. It helps in the movement of the tongue, but it also helps in swallowing. So that is your hyoid bone that sits up there in your neck. It is actually not directly articulated with any of the other bones. It actually connects via ligaments, but there's no like direct joint. Okay, so this is my trachea. You'll notice that there are these folds. And then within these folds, we have the vocal folds, which are your vocal cords. So let's look at another image of that in our images. Oops, that's not the one I want. Sorry, image. Here we go. Okay. So looking down in the throat, they can actually use a little scope to look down into your throat to see what is going on. This is my vocal fold. It is white because it is avascular, which means it doesn't have any blood vessels in it. This is the opening. So this is the glottis. This is opening into the larynx. You can see up here that this is actually the epiglottis, right? And then you can see the cartilages down here. So we can open up, right? And what you're doing here is you're seeing down into the trachea. And then these vocal cords, when we bring them together and we force air out through them, they will vibrate and they will create the sound. Okay, so let's look at next the trachea. Oh, I forgot to mention something very interesting that I just discovered. I had no idea this was the truth or that this actually was a thing. But your epiglottis actually has taste buds on it, as do you like your cheeks. The inside of the cheek has taste buds, and maybe part of the esophagus, but your epiglottis can taste. So they're not really sure what it actually tastes, but it does have receptors that can bind to chemicals that are found in food. So perhaps you have some taste sensation in your epiglottis. So let's next look at the larynx. Not the larynx, the trachea. Okay, let me see. Okay, so the trachea. So the trachea is super interesting because it is pseudo-stratified, ciliated, columnar epithelial tissue. So just like our inside of our nose, our nasal cavity, pseudo-stratified. It looks stratified, but it's not. It is ciliated, columnar epithelial tissue. You'll remember that epithelial tissue is what lines organs. It is also what makes up our epidermis, the outside of our skin. Okay. Ciliated, because there's little cytoplasmic extensions. So if I were to look at this, I would have these column-shaped cells. They would have like a nucleus in them. They might look like they're pseudo-stratified because there's these weird shaped cells in there that are referred to as like goblet cells. So this could be like a goblet cells. These have cytoplasmic extensions called cilia. And so I'm going to say that this is my, I didn't draw that very well, but this is my goblet cell. And the goblet cells produce mucus. So your trachea is producing mucus, and it is filtering stuff. But think about it. When we take air in, it's going in, so it's carrying stuff in. So how does it capture stuff? Well, it uses the mucus to capture it, and then the cilia move it back up. If you think about our lungs, they're like this blind-ended pouch, right? If the mucus moved down, that would be very bad, because then it might get into the respiratory membrane. It might prevent us from being able to get oxygen. And in fact, this is what happens when we get like lung infections, like pneumonia. We get mucus in our lungs. We get fluid buildup on our lungs, right? We can't breathe. And so this is an interesting mechanism, because all the time I can feel it as I'm speaking. I can feel mucus in the back of my throat, and the cilia are forcing that mucus to come up. And for the most part, you swallow it. So let's look at a diagram showing that trachea. Okay. So this is actually a cross section through the trachea and through the esophagus. So this is the esophagus is right here. It is behind or posterior to the trachea, which is right here. Blue, this light blue, that's the tracheal rings. That's what supports, right? It's hyaline cartilage. And then the lining, let's look at this lining. These are column-shaped cells with goblet cells. You can see the cilia. And then you can see underlying support cells. So this is an organ because it's made up of more than one type of tissue. So if I were to look at an electron microscope, which actually takes pictures of the surface of cells, these are the cilia that capture debris and then move it back up to our throat. Now, one of the interesting things about the cilia is it can be destroyed by smoking, specifically like cigarette smoke. So cigarette smoke destroys the cilia. So this is why we have what is called the smoker's cough. So if you've ever lived with somebody who smokes a lot, or even if it's you, you might know that in the morning they get up and they have to cough and cough and cough and cough. And the reason why is they have this mucus buildup from when they were sleeping, and their cilia wasn't able to remove the mucus. And so they actually have to hack that extra mucus up. This is also why they say on cough syrups that you should not use them all the time. So like if you're a smoker and you can't sleep because you're coughing, you're actually coughing because you need to cough in order to get that mucus to move, because it can't move on its own because the cilia have been destroyed. So if you take cough suppressants like cough medicine, that is going to suppress your cough, and that might actually lead to a greater chance of getting infection. So that's why they say do not use this product for more than 7 days in a row, because if you're like using cough suppressants just to get through the night every night, right, you could possibly get some lung infection because of that extra mucus. The interesting thing and the good news about this is that these cilia are able to repair themselves. So as soon as you stop smoking, you quit smoking, you're going to find that like within a week, within a month, right, you no longer have that smoker's cough. So this is repairable. It just, because this tissue actually regenerates itself on a regular basis, it is something that can be repaired and replaced. So again, this is still part of the conducting zone, not part of the respiratory zone, because in the trachea, we still do not have gas exchange.